Man, I wish there was something to help me with my allergies.
What is that? It's me, Flonase. I am a topical nasal decongestant that helps with allergies and nasal polyps.
Flonase, thank goodness you're here, but how do you work?
To use me, you would blow your nose, stick this up inside of one nostril, and squeeze. Once I enter your nose, I produce a direct local effect, blocking many reactions that are responsible for the inflammatory response. However, my onset is not immediate. I might require a few weeks to make any changes, but if you're using me for 3 weeks and you don't see any changes, call your doctor. But wait! You're not taking any other nasal sprays, are you?
Nasal sprays? No, I don't think so.
Okay, good, because you can't take me with any other nasal sprays, but it doesn't interact with any other medication systemically. You also can't take me if you have any acute infections, active infections, including tuberculosis. If you have repeated exposure to airborne infections, such as chickenpox or measles, you're pregnant or breastfeeding, or you have any skin lesions in your nose. None of those apply to you, correct?
No, none of those apply to me, but are there any side effects I might experience when taking this medicine?
Side effects include burning, irritation, and stinging inside your nose. You can also get dryness of the inside of your nose, a headache, some delayed healing, which could increase your risk of infection, and some rebound congestion if used too frequently.
That makes sense. Is there anything else I need to know about this medication?
Well, like I said before, you want to avoid any exposure to airborne infections. You want to call your provider if you don't see any change in symptoms after 3 weeks of use. You want to take up to a week for the effects to be seen. Some initial burning and stinging might happen in your nostrils. You want to administer in one nostril at a time, not both. You want to make sure that you're fully clearing your nasal passages out before you insert the probe. And you want to make sure that you're taking this drug regularly, because that's how you'll know if it's going to work.
Wow, that sounds great. Thanks, Flonase. As a nurse, make sure to monitor patients who just had nasal surgery and trauma to make sure healing has occurred. Also monitor for fungal infections, acute infections, and effectiveness of the drug. Also be sure to monitor for adverse effects, and don't forget to perform an intranasal exam to ensure there are no lesions inside the nose.